This week, I'm myth busting certain things you may hear about back pain or getting out of back pain. I came up with 10, nice round number. The first one is back pain is not reversible. Getting out of pain is not the equivalent of healing all your tissues back to the way that they were when you were a younger person. You can have tissues that might have been damaged, like me, have scar tissue, degenerated discs, and not be in pain anymore. And that's because the pain is associated with damage happening, damage currently occurring, or possibly just the threat of danger or damage to your body can cause pain. Pain is a very subjective thing. And so there is not a good correlation with diagnoses or conditions that we see in an X-ray or an MRI and pain. There are people that have terrible looking spines that have no pain at all, and there are people that have severe pain with spines that don't really look that bad. So you can disassociate your condition with your pain. That's all you have to do is you have to stop the damage from progressing. And this is true for any part of your body. So remove the problem and back pain can go away. All right, number 2, rest will help your back. You just need to rest more. This is not true at all whatsoever. Your back does not hurt because you're not resting enough or that you're doing too much. Your back hurts because it's not supported enough. And your spine doesn't have enough support. That's the general, most common theme. And your abdominal muscles, the deep abdominal muscles, do not do well when you're resting. They're not active, and they shut down even more when you rest. And so using your core, using your body is a way to get these muscles activated and supporting your spine, and is the best thing you can do for back pain. I would never recommend anyone to rest more than 48 hours for someone with a flare-up or an event or episode of back pain, because at that point, your muscles will start to atrophy. If you don't use them, you lose them, and your spine needs those deep core muscles to support it. So using them is the best thing you can do. Number 3, you're just getting older. Back pain is a result of aging. This couldn't be farther from the truth. Yes, there is a correlation between increased back pain and aging, but it is not a causation. And 80% of people at some point in their lives will get back pain, but there's still that other 20% of people that go their entire lives without experiencing back pain. And you can say, oh, they have better genetics. Well, I got back pain when I was 16 years old. And my parents, neither of them have back pain. Back pain can happen at any age, and it is the result of other causes: muscular imbalances, not enough support for their spine, repetitive trauma. It could be just an acute injury. These things that I'm listing are more likely as you get older, but aging itself is not the cause of back pain. Myth number 4 is you just need to strengthen your abs or your core. This is a myth because it's not just about getting stronger. It's not just about your ab muscles becoming stronger. It's actually about restoring balance in the musculature around your spine. So your spine is supported 360 degrees, and it is actually a result of a strength imbalance why many people have back pain in the first place. So if you just go do a bunch of sit-ups, and a lot of us have experienced this, just strengthening your abs, that's probably going to make your back pain worse. And that's because we tend to strengthen the imbalance when we just go do a bunch of strengthening. What we need to do, we need to restore balance for support of the spine. And this is probably the hardest thing to do. I could be talking to a little old lady, never had back pain, 85, 90 years old, does not have strong abdominal muscles. She more or less could have very weak abdominal muscles and still not have back pain. And why is that? It's because she has balance in the system of muscles surrounding her spine. This old lady that has no back pain but very weak muscles might have an equal balanced amount of strength in her psoas and her obliques and her six-pack, and that balance around her spine creates a supportive system that does not pull the spine in different directions as someone would, like me, who was actually in my teens when I first developed back pain. I was practicing bodybuilding. I was very strong. I had very strong abdominal muscles, and I got back pain not because I was weak or too strong or anything. It was because there was an imbalance in the muscles surrounding my spine, and that imbalance created problems. Myth number 5. If you have back pain, you just need to refrain from exercise. You need to do less. That is the worst thing you could do. Unless you have had a spinal fusion and you are waiting for your bones to fuse, and you should be avoiding activity because of this one specific thing. You need that hardware and your vertebrae to fuse together, and you don't want to ruin the purpose of that surgery. That is the only reason I would recommend doing less or refraining from exercise. Otherwise, you need to be doing something. And if exercise hurts you, then it's not about the exercise itself as a general umbrella that's the problem. It might be how you're doing that exercise, or it might be which exercises you are choosing to do. But there is something out there that can help restore balance in the muscles of your core that's going to make you feel better. And refraining from exercise is probably the worst thing you can do if you're trying to get out of back pain. Myth number 6 that I want to bust is when people say, just use your legs. You need to use your legs more. You're going to pick up this object from the floor. Just make sure to don't use your back. Use your legs. And I vehemently disagree with this, because a lot of the problem that we are dealing with as a population of people in chronic lower back pain is that we are overusing certain muscles and underusing others. And those muscles that we tend not to use enough are the muscles that surround our spine. We're trying to protect our spine. We baby our spine because we don't want to hurt it. And this is how the muscles get weaker. And it's a feedback loop that perpetuates itself, because if you don't use it, you lose it. And so you want to use your core to pick up objects. Myth number 7 is something like this. I cured my back pain when I did this. And the fill in the blank, this might be something like, I used this cream, or I got my back cracked or adjusted in this way, or I did this stretch, or nutrition supplement. I started taking turmeric. These types of statements are not possible ways to get out of back pain, because the lack of taking turmeric is not what caused back pain. There is a cause of back pain, and it is not something that you can just snap your fingers and do one thing, like get your back cracked in a certain way, and it's going to fix chronic back pain. That might work for somebody that had back pain for 2 days, but if we're talking about chronic back pain, which is 3 months or more, it is not easy. And we all know that it is not easy to get out of back pain. You can't just make one adjustment or do one thing in your life and get out of pain. It requires a lifestyle change. It takes more than just doing one thing. You'll often hear people say, oh, all you need to do is stretch your hamstrings, and that's going to fix your back pain. Your hamstrings are tight. So anytime you get advice from a normal, non-professional on the street that involves just doing one thing and that's going to get you out of back pain, I really wouldn't take that advice. Myth number 8. When you see that latest and greatest gadget or device on whatever, Instagram or commercial or in the store or whatever, and you get that feeling of hope, those things are all under this same category of being external things. They're outside of you. And the real solution to back pain is going to be internal. It's going to be inside you. It's going to be in your mind. It's going to be learning how to operate this body in a healthier way. It's going to be this persistent effort that's required by you to try to restore balance in your body and make this lifestyle change that goes together with getting out of back pain. And typically external devices and gadgets and treatments and things, maybe they can help you on that journey, but they themselves cannot change the way that you relate or operate this body, because that's a neuromuscular process. And that's really what you should be focusing on. So myth number 9, when you are told, or maybe you believe that back pain is 100% physical or 100% mental, psychological, there are people in both camps. I'm going to say that there are probably both factors involved. It's a little bit mental, a little bit physical. Maybe there's a scale and it tips more towards one or more towards the other. And it's going to be elements of both. And I just wouldn't go to the extreme of jumping into one of the camps that say, it's 100% psychological. That means my solution is going to therapy and I'll be fine if I just sit in a chair in therapy for 3 hours a week. That's going to how I'm going to get out of back pain. I think maybe that could be a good approach together with doing some things to improve the physical health of your body. That's just the camp that I live in. Finally, myth number 10 that I would like to bust. If you have back pain and it's chronic, you're doomed. You're never going to get out of back pain and you are bound for surgery and it's just going to get worse and worse until the end of your life. Well, even if you don't get out of back pain and you can go throughout the rest of your life with back pain, it's not necessarily just going to keep getting worse and until you're disabled. A lot of people have minor back pain or moderate back pain and they just live with it. Actually, there are people out there that are kind of okay with it and they just go through their lives with it. It doesn't mean that there is any specific ending that is definitely going to happen, that you're doomed for, that you're going to need surgery. And so I don't know if that helps maybe take a little bit of stress or a little bit of just load off of your back, for lack of a better term, that it's can be okay to have a little bit of back pain. It's part of us, and it doesn't mean that you're destined for doom or your life is going to just be over someday. So I'm just being okay with some back pain and not associating it with the anxiety of the future is going to be miserable. And there is hope that you can actually do things to get out of back pain. So we're going to circle back to number 1. It is reversible, and there are things you can do to get better. I hope that busting these 10 myths that I believe to be myths can just help give you some insight in what to do for your back instead of wasting your time on these 10 things that other people may have told you or you may have seen on a commercial, and potentially spend your time doing something more effective for getting out of back pain. And it's always going to be related to a lifestyle change. So remember that. And until next time, get down on that floor and connect to your core.